Welcome to the Neuro Wellness Podcast. I'm your host, Dr. Joseph Koppas, and today I'm here with my guest, Dr. David Traster, and he's going to be talking about what functional neurology is. So welcome, Dr. Traster.
Thanks for having me.
Yeah, of course. So tell us a little bit about what functional neurology is for those who don't know.
Well, functional neurology really isn't a specific term in healthcare. It was really a concept that started about 40 years ago. And right now there's medical doctors, there's chiropractors, there's physical therapists, there's acupuncturists, there's occupational therapists that all claim to be doing functional neurology. Mm-hmm. So how did functional neurology really start? Well, classically, functional neurology is really a form of neurological rehab. Throughout time, neurological rehab is really based on post-stroke, post-tumor extraction, or maybe the tumor can't be extracted, meaning that there's an area in the brain that had problems. And that area was not going to be fixed. You know, if it was a stroke, there's parts of the area that died. And the idea of neurological rehab was saying, can we improve function and help someone compensate so they can move better, have decreased symptoms, etc., while we know we're not going to fix the area of the brain that's injured. Okay. However, we know now that a lot of problems in the brain, you might not see them in MRI. You might not see them on CT. It might not be from a tumor. It might not be from a stroke. It's a functional problem in the brain, the way the brain's communicating, the way the brain's firing, etc. And so what we have to do as someone who practices functional neurology, which again is kind of a blanket term, It really just means that we understand normal brain function, we know how to test normal brain function, and we know what abnormal is. Okay. And it gives us a window to really do very specific neurological rehab for a variety of patients, whether there's MRI findings like a stroke, or whether MRI is normal, but they have symptoms like dizziness or brain fog, etc.
Interesting. Okay. So how did you ever end up even getting into functional neurology?
So I got very fortunate. While I was in school, the doctor who really spearheaded and started functional neurology, Dr. Carrick, he really showed up in my school, and he started seeing patients, everyone from professional athletes at the highest level to your grandma. And he saw patients with a variety of conditions like we were talking about, whether it was concussions, whether it was acquired brain injuries like post-tumor or post-stroke, whether it was dizziness, whether it was chronic pain, maybe pain in the head like a headache, pain in the arms, the hands, the legs, the feet. Saw a lot of children with developmental issues, whether it's ADHD, dyslexia, different autistic spectrum disorders. As people got older, he saw people with balance issues, walking issues, cognitive issues, memory issues. And so I got very fortunate to really learn under Dr. Carrick, really see what he was doing, and really try to absorb as much information as possible from him.
Yeah, that's a great opportunity.
Absolutely, and thanks to that, it really set me up to start teaching. So right now I teach around the world on these type of applications, including for Dr. Carrick, which is always an honor for me because being able to spread the information he passed down to me, the type of care that I give now and the results I see from my patients, it's important for me to spread that out so more people get the type of results that I learned from Dr. Carrick.
Of course. So you had mentioned that sometimes you can't see on MRI where the issue in the brain is, right? Mm-hmm. So what are some of the ways that you're able to determine these issues or these
Absolutely.
areas?
So when you look at how we evaluate a patient, I think that's the biggest thing that differentiates someone who might practice functional neurology compared to other practitioners. And in our clinic, I partnered with a clinic up in Chicago, so now I'm a partner of what's called the Neurological Wellness Institute, or the Neurologic Wellness Institute. And we have 2 clinics in Chicago, and we have a 10,000 square foot clinic up by O'Hare Airport and 5,000 square feet in downtown Chicago, right on Michigan Grand. And no matter what clinic you go to, every patient gets the same 3-hour evaluation. And our evaluation is really important because I can't create a management plan for you unless I really know the cause of what's giving you problems. And many patients we see, they don't know the cause. So we have to really look in and do a lot of different testing to see areas of the brain that are functioning well and areas of the brain that aren't functioning as well. So how do we do that? The first thing we do is we do what's called a QEEG. And what it really does, simplistically, is we put a cap on your head. It reads your brain activity of all different areas of your brain, the front, the back, the sides, and then it compares your activity against this big database of people who are considered normal, no symptoms, and it says, you know what, your brain in the front is firing a little faster than the normative database. Your brain in the back might be firing a little slower, so it gives us opportunities to look at people's brain function and their electric activity. Okay. The next thing we do is we do about 15 different neurocognitive tests. And the important thing is each test is a different area or network in the brain. Different functions, whether it's attention, whether it's different types of memory. So it gives us windows to say, how is your cognition? How are you thinking? How is your memory? How's your spatial awareness? And the tests that you do well on, we're going to assume that those areas of the brain are pretty healthy. The tests you're not doing so well on, we're going to assume those areas of the brain could be healthier. They're not functioning as well as they can be. We then do an eye movement test. We have a digital recording of all your eye movements. And the important thing is we're not looking like for eye disorder or muscle disorders, which we look for, but each eye movement really represents different areas of the brain, and it's pretty definitive in research these areas. So we want to look how quickly and accurate you move your eyes from point A to point B, how well you follow a target left and right, up and down, and that correlates to different areas of the brain. And if we can see improvements in these eye movements after a therapy, it just means that areas of your brain are functioning better most of the time.
Okay.
We then do balance testing. And we have a digital platform. We do a variety of different balance tests on eyes open, eyes closed, on a flat surface, on a foam surface, different head positions. And it really gives us a nice window on how your brain's using information from your eyes and your vision, how it's using information from your neck and your body, how it's using information from your inner ear, to try to differentiate where is the problem and how is your brain compensating for it.
Okay.
We also do a full neurological evaluation. And that gives us, let's put it simple, information how your brain is controlling your body, how your body's communicating to your brain, and how your inner ear function is working that communicates into your brain as well. Or put it to say it differently, if I look in your exam and you're moving a little incoordinated in your right hand, that gives me windows into parts of the brain that control that movement.
Okay.
And after that 3-hour evaluation, we sit back with our patients right then after all the tests are done, and we look at everything and we correlate all the data, and we say, okay, these are the tests that you did really well on. These tests correlate to these areas of the brain, which mean these areas of the brain aren't the ones that are causing your symptoms, most likely. Here are the tests that you didn't do so well on. These are the areas of the brain that correlates with, and so we're going to focus most likely on those areas if we feel like those areas also correlate with the symptoms that you came in with.
Okay. So let's just say, for example, I come in and I sustained a head injury maybe a year ago.
Yep.
I've got headaches that just won't go away and dizziness, etc. And then I come in, you do your evaluation on me, and it turns out that there's the QEEG, we run that, the balance, the eye movements, and the neurocognitive testing, and you're able to say, okay, this is what's wrong with you. What then would you do to help me get back on track?
Absolutely. So the first most important thing of our evaluation is to determine if I can help you. Because there are patients that I just might not be able to help, and I want to know that right away. So the first thing is to say, based on your evaluation, is this a case that I can help with? Or is this a case that I'm better off referring to someone who's a better position to help? Now, if I feel like I can help you, the next question is, what do we do? I tell all my patients, we have hundreds of therapies we can do. The goal is finding your brain function, what's going on with your brain, and the right therapies for you. Okay. So what does that mean for an example like in a concussion? When you look at concussion, there's a thought that the brain bounces like a counter-coup injury, and that can happen. We now know a lot of problems with concussions is the rotation of the head. When the head rotates, the brain can twist and rotate, and that twisting of the brain creates shear force, and that shear force is very easily damaging the brain. So it really easily can damage the brain, and then it really comes down to what connections were damaged. Everyone's brain is different before the concussion, and you're at a different starting point, but having said that, every injury is different. You might rotate your head this way with a concussion versus this way. You might get hit on this side of the body versus this side. You might get hit harder versus another person. So there's so many variables to look at with concussions. What we want to look at is say, what functional limitations do you have? Where does that correlate to areas of your brain? So if I see area A is not communicating to area B as well in your brain, and that correlates with a certain function, that's going to point me to do rehab for that area. So let's give an example. If all of a sudden you're not doing so well in your neurocognitive testing, I could say, okay, that test that you failed on has to do more with this frontal part of your brain to this back area of your brain. And so what we're going to do is specific therapies for that. And that could be therapies like mathematics, that could be therapies like memory therapies, that could be therapies like multitasking, like spatial awareness therapies. We have tons of cognitive therapies we can do. Okay. Let's say in our evaluation that your balance isn't so good. We can say, well, that concussion might have impacted the pathways in your brain that affect your balance. So maybe we do more vestibular balance type therapies, maybe do more therapies toward the legs, and active therapies like muscle therapies that we can do to make you stronger. Let's say your eye movements will are altered. We can do specific eye exercises to make your eye movements more appropriate. And it's not so much about the eye movements, it's the parts of the brain that control the eyes.
Okay.
Let's say we see QEEG findings. If we see abnormal brain activity, we do therapies like neurofeedback. We have virtual reality therapies. We have tons of electric stimulation therapies that are all non-invasive. They don't hurt. We have chairs that rotate in specific directions to kind of stimulate your brain very specifically. Okay. And the big picture is what we like to do is we know that everything activates the brain. Whether it's light, whether it's sound, whether it's movement, everything in the world is going to activate your brain. Can we do specific therapies that are geared towards specific areas of your brain? Meaning that if I had a bicep injury, I'm not going to do rehab to my foot most likely.
Of course, yeah.
I'm going to do rehab to my bicep. So when we look at our evaluation, we want to localize the areas that have problems and only do therapies for those areas because sometimes it's common to give people too much. Yeah. You know, sometimes with dizziness, people get hours worth of therapies or half-hour therapy and they have every type of therapy to give. And hopefully that it gets you better. Yeah. What we want to do is say, no, we're going to see you for an hour, but for you, you're going to do 4 therapies for an hour. For the next person, they might do 20 therapies for an hour. So it really depends on our evaluation, the type of therapies we would then choose based on the evaluation.
Yeah, and based on that specificity, you would imagine that people would get better in maybe a quicker fashion.
That seems to be the pattern, and that's the idea of this functional neurology, is really to try to understand the function of the patient and match specific therapies for that one patient versus more of like a protocol, cookie-cutter approach. Like we all like to write books and give information that people that don't come to the clinic, I have a concussion from Europe, how can you help me? And unfortunately, I can give some general advice, but the general advice usually is not as effective as really doing a good evaluation and understanding why this person has those symptoms. Because 10 concussion patients might have similar symptoms, but the evaluation could be greatly different. And the treatment for each patient could be completely different. So giving a protocol approach or cookie-cutter approach might help 3 of the 10. But what about those other 7? We're better off doing individual therapies to hopefully get all 10 out of 10 better.
Of course. So let's say that I then decide to come to the clinic.
Absolutely.
And you treat me specifically based on what you find. You have the objective findings, and then throughout care, you're obviously expecting these objective findings to get better that you did.
That's the hope.
These subjective findings are eventually getting better, and then I should be good to go.
Well, the hope is that we don't know. What we do is we do about a 3-hour evaluation day 1. Most of our patients are in the clinic for about a week or 2, and we do the same evaluation when you leave. Yeah. And we're just going to take as much objective data, black and white, out of my control, and we're going to look, does your brain objectively get better from our therapies?
Right.
What we typically see is when our objective data and tests get better, people's subjective findings improve and their function improve.
Okay.
We also see our goal of our therapies is also to give people things that they can do at home. So what we want to do is say, you might be with us for 2 weeks, but you might have had a head injury 5 years ago. Our goal is to make you self-sustainable. Our goal is that you're not relying on us or anyone else. We're here as a support system, and we're here to help you if you need to change things, but we want you to do your therapies at home because we know people who do active therapies at home get better results. Yeah. And we also know that if you could do your therapies at home, it's easier, it saves you time, and it saves you money than coming into the clinic. So for most of our patients, we give very specific at-home exercises, usually about 2 to 5 minutes, 2 to 3 times a day, so it's relatively easy to do. And for some patients like a concussion, you might do it for a month or 2, feel better, and then not do them anymore and be great. Other patients like a stroke might have to do these things the rest of their life. The reality is our therapies aren't specific for any condition. Our therapies hopefully will improve brain function. So the reality is even if your symptoms go away, our therapy should still help you function at a higher level. And most people, because it's easy to do and they feel better from the at-home therapies, they continue to do it just because they feel better doing it. So it's kind of like brushing your teeth. Every day you just know it's healthy for you, and you just continue to do it. Or if you get a little older, you see memory issues, why not do some memory exercises every day?
Of course, yeah. Just makes sense.
Yeah, absolutely.
And then I guess as a potential patient, I would like to know, what are the success rates? Can you speak to those?
Absolutely. So we right now in our Chicago 2 locations are very active in collecting data. Because at my last clinic down in Miami, most of my patients flew in from around the world for 5 days, and it was very hard to track information once they left. So all of my data I have now is only 5 days. Our hope is with this new clinic in Chicago to not just collect 5 or 10 day data, but to collect it in 3 months, 6 months, 9 months, 12 months, 2 years, 3 years, 5 years, and actually show that people that came in for 2 weeks 5 years ago are still doing great today. And that's what we're passionate about, is proving that the therapies are effective, proving that there's people who could really benefit from them, proving to the insurance companies that this works and that they should cover it, so people could hopefully get this care in more places around the world and be covered so it's more affordable to them.
Absolutely. Well, that's great. Well, I think that if no one knew what functional neurology was before listening to this podcast, I think they'd have a pretty good idea of what it is now and if it would be a good help for them. So if people wanted to find out more about you, about functional neurology, etc., what would be a good place for them to?
Absolutely. So our website for our company is neurologicwellnessinstitute.com.
Okay.
And that has contact toward me and to our clinic with phone numbers, and you feel free to contact us through the website. But also, I teach around the world in this therapy because I'm passionate getting this therapy affordable and available to everyone around the world. So there are people around the world that do this type of therapy. The question is, each clinic's a little different with different technology, different doctors. So our hope is continuing to train people at a higher level so people could have local practitioners, whether it's a medical doctor, whether it's a chiropractor, whether it's a physical therapist, whether it's an osteopath, that's trained at a high level so there's not so many people struggling from neurological conditions.
Okay, that's great. That's great. Well, thank you very much for being on the show today, Dr. Traster. Any closing remarks before we sign off?
No, I just think that the biggest thing is a lot of times people use the word functional neurology, and the reality is it's really just not a real word, so it creates confusion. So I think my goal of this talk was really just to say functional neurology is really a form of neurological rehab. It's done by a variety of different professionals, and that it's very evidence-based the way we do it, and we're hopefully going to collect data to prove the model and expand it so more people could benefit from this type of care.
That's great. That's great. Well, thank you again very much.
Thank you.
And from your host, Dr. Joseph Kappas, this has been the Neurologic Wellness Podcast. Signing off. Be well.
Thank you.